Hi everyone! Today we will be discussing and demonstrating the use of an oral irrigator. So here's my example of my Waterpick. The oral irrigator is perfect for anyone, but is especially beneficial for those who have appliances that make it more difficult for them to effectively remove plaque biofilm and debris. This includes those with orthodontic appliances, implants, or crowns and bridges, or even those who may not have the best oral hygiene. An example would be my dad, who has arthritis, so he uses his oral irrigator in conjunction with floss.
So this aid targets all areas of the gingiva and teeth. The water penetrates under the gingival margin to remove biofilm that contains bacteria that contribute to the progression of periodontal disease. The pulsation and pressure of the oral irrigator removes the biofilm both above and below the CEJ. Various antimicrobials like chlorhexidine can be added to the water also. Additionally, the water temperature can be adjusted to each patient's personal needs.
So the oral irrigator provides many advantages for those who use it. For one, the pressure and pulse of the water are able to penetrate deeper into the pocket than regular toothbrushing or flossing techniques. Research studies have proven that the oral irrigator can penetrate as far as 6 millimeters into the gingival pocket, which is much deeper than toothbrushing and flossing alone.
Additional research has been found that oral irrigators can reduce bleeding and inflammation, along with maintaining the reduction of bacteria following periodontal root debridement.
The main disadvantage with the oral irrigator is the mess that is made, so it limits where it can be used. Another disadvantage is that this is not a substitute for flossing. It is meant to be used in conjunction with flossing to enhance plaque biofilm removal.
According to Mosby's comprehensive review of dental hygiene, contraindications for this device are patients with periodontal abscess or ulcers or those with severe dexterity problems. Patients should also be monitored for transient bacteriemas or any adverse effects from the irrigating device.
And finally, the only limitation of the aid based on extent of the disease present is that this aid is used to maintain treatment. It is not meant to be a substitution for professional care. Instead, it can only be effective if the patient has had professional periodontal debridement first. So I'm going to hold my Waterpick at a 90-degree angle, and I'm going to keep it 3 to 4 millimeters from my tooth. So I'm going to go along my gingival margin and stop interproximally. So this is what it will look like.